So you're running a home care agency, putting everything into your clients, but maybe feeling stuck when it comes to real sustainable growth. Does that sound about right?
It's a common challenge, definitely.
Yeah. Well, today we're doing a deep dive into some strategies that might help. We're looking at an article from Roxford Digital. It's called Grow My Home Care Agency, the proven path to consistent clients and scalable success.
Good piece. Lots of actionable stuff in there.
Exactly. Our mission today is to pull out those key practical strategies, the things that can help you get past those plateaus and build an agency that, well, scales properly and gets clients consistently.
Moving beyond that reactive mode, a lot of agencies fall into.
Right. So we'll be digging into building a predictable client pipeline, how to actually stand out when everyone seems to offer the same thing, why your team is so critical for growth, and the numbers you really need to keep an eye on.
To vital signs of the business, essentially.
Okay, let's get into it. Where do we start? Probably with getting those clients in the door, right?
Yeah, I think the fundamental shift, really, that the article hits on, it's moving away from just, waiting.
Waiting for the phone to ring? Or for referrals?
Exactly. Waiting for referrals, hoping for the best. The focus has to shift to actively building a system, something that generates leads consistently.
Like an engine for growth.
Precisely. Think of it like that, a marketing engine. It's an asset you build for your agency, something that keeps working. Even when you're, pulled in a million different directions managing the day-to-day, it's about being proactive, not reactive.
Okay, proactive. So what does that system actually look like? The article breaks it down, right?
It does. It talks about several key components working together.
Like local SEO, making sure people find you when they search nearby.
Yep, that's a big one. Showing up in those local search results, critical. Then you've got paid ads.
Strategically, though, not just throwing money at Google.
Right. Targeting people who are showing high intent. They're actively searching for home care services right now. You want to be visible at that exact moment.
And the website itself. The article mentioned making sure it actually works. Like, it convinces people to call.
Oh, hugely important. Website conversion optimization. You can drive all the traffic you want, but if your website is confusing or doesn't build trust or makes it hard to contact you,
people just leave.
They bounce.
Yeah.
Exactly. So it's about clear calls to action, request a consultation, learn more, easy to find phone numbers, maybe even online chat, making that online experience smooth.
Guiding them from just looking to actually reaching out.
Yes. And don't forget the follow-up systems mentioned. Email, maybe SMS, for nurturing those leads who aren't quite ready to commit on the first visit.
Right, staying top of mind, providing value. So the big picture here is consistent leads aren't luck. They're the result of a system you build and maintain.
That's the core idea. It takes work, but it creates predictability.
Okay, so let's say the system's working, inquiries are coming in now. How do you convince them to choose your agency over all the others? The article really drills down on this, doesn't it? What makes you different?
It does, and this is where having a really strong, clear positioning statement is just, it's non-negotiable.
Because saying we offer great care isn't enough anymore.
Not even close. Everyone says that. You need to get specific. The article talks about really understanding your ideal client. Who are they, really?
Like, are they the adult children? Maybe private pay, looking after aging parents?
Could be. Or maybe it's people needing short-term help after surgery, post-surgical discharge. Or perhaps it's folks needing ongoing personal care long-term. Each group has very different needs, different worries.
So you identify your ideal client segment.
And then you figure out their specific unmet needs. What are their biggest pain points? What keeps them up at night related to care? And crucially, how does your agency uniquely solve that problem for that group?
Okay, so it's not just who you serve, but why you're the absolute best fit for their specific situation.
Exactly. And that's what your positioning statement needs to communicate. Clearly, concisely.
And the article stresses putting this everywhere, right? Website, social media. It needs to be consistent.
Absolutely consistent. Someone landing on your website should immediately understand who you help and why you're the best choice for them. It shouldn't feel generic.
It should resonate with that ideal client you've identified.
Precisely. Using their language, addressing their specific concerns. This focus helps attract the right clients, the ones you're best equipped to serve, who are likely to be happier and stay longer.
And it probably makes your marketing more efficient too, because you're not trying to be everything to everyone.
Exactly. You're focusing your resources. It makes you wonder how many agencies actually take the time to do this deep thinking about their ideal client and craft that specific positioning.
Yeah, it feels foundational, but maybe easy to skip when you're busy. Okay, let's shift gears a bit. Growth isn't just about leads, it's about capacity. The team. The article links scaling directly to having the right people, right?
Absolutely. You simply cannot scale effectively without a strong team. And it goes beyond just hiring. The article emphasizes building an internal culture.
A culture of excellence and growth.
Yes, a culture where people are aligned with the agency's mission, where they feel valued, and where providing outstanding care is the standard. It's about building a cohesive unit.
And how does that connect to the agency's brand? There's a line in there. Your brand is a promise.
Yeah, I love that line. Your brand is a promise. Think about what that means. Every single interaction, whether it's a caregiver with a client or your office staff answering the phone, it either reinforces that promise or it breaks it.
So training becomes really important. Not just skills training, but training on the brand.
Exactly. Training needs to reinforce how you deliver on your unique promise. If your promise is, say, exceptional communication with families, then your training needs to explicitly cover that, and your processes need to support it.
Makes perfect sense. And the article also mentions something interesting, that marketing isn't just for clients. It helps attract caregivers, too.
That's a critical point, especially now. The hiring market for caregivers is tough.
Yeah.
Your agency's reputation, your brand, the culture you build, those are huge selling points for attracting quality caregivers.
So a strong brand helps on both sides, client acquisition and talent acquisition.
Definitely. Happy, engaged caregivers who believe in the brand promise to deliver better care. Better care leads to happier clients, better reviews, more referrals. It's all connected. It creates a positive cycle that fuels growth.
Your caregivers are literally the face of your brand promise every single day.
They absolutely are. Their commitment and satisfaction directly impact your agency's reputation and your ability to grow.
Okay, so we got a lead system, clear positioning, and we're building a strong team culture. How do we know if it's actually working? How do we track progress? This brings us to metrics.
Yes, the numbers. The article has that great quote, "What you measure will improve."
Simple but powerful.
It really is. You have to move beyond just, counting clients or hours billed. You need deeper insights, key performance indicators, or KPIs.
Right, and the article listed some key ones, like the cost per lead, how much it costs to get one potential client inquiry.
Yep, cost per lead, CPL. Essential for knowing if your marketing spend is efficient. Then there's your lead-to-client conversion rate.
So what percentage of those leads actually sign up for services?
Exactly. This tells you how effective your intake process, your sales conversations are. If CPL is low but conversion is also low, maybe the problem isn't getting leads, it's closing them.
Okay. What else? Client lifetime value.
Crucial. Client lifetime value, or LTV. How much revenue does the average client generate over the entire time they're with you? Knowing this helps you understand how much you can afford to spend to acquire a client.
Puts the cost per lead into perspective.
Absolutely. And you also want to track where your best leads are coming from referral source performance. Which marketing channels, which referral partners are actually bringing in the clients who have a high LTV.
Focusing your efforts on what works best. And online reviews too, right?
Oh, definitely. Online review ratings are huge for social proof and reputation management. They directly impact whether new prospects will even call you.
So these metrics aren't just numbers, they're like diagnostic tools.
That's a great way to put it. They give you a data-driven view of your agency's health and growth potential. They show you where the bottlenecks are, where the opportunities lie. You can make adjustments based on data, not just gut feeling.
The article mentioned a program, the Agency Accelerator, that helps implement these kinds of things. Local visibility, conversion, execution.
Yeah, it briefly touched on that, and it mentioned it being selective.
Which kind of highlights that this stuff, building systems, tracking data, it takes real commitment, doesn't it?
It does. Sustainable growth isn't passive. It requires focus, strategic thinking, and consistent execution. It's an ongoing process.
So wrapping this up, the big takeaway from this deep dive, drawing on that Roxford Digital article, seems to be, if you want to break through those growth ceilings in home care, you need to ditch the reactive approach.
Absolutely. Get proactive. Build systems.
Understand who you serve best, create that unique positioning, really invest in your people so they can deliver on your brand promise.
And track your progress with the right data. Know your numbers.
It's about intentional, System-driven growth, not just hoping things get busier.
Exactly. Consistent growth doesn't happen by accident. It's engineered.
So maybe a final thought for you listening. Thinking about all these pieces, the pipeline, the positioning, the people, the performance tracking.
Yeah.
Which one of those feels like it could make the biggest difference for your agency right now?
Yeah, what's one small change, maybe, based on this, if you implemented it consistently? What could start making that phone ring a little more predictably for you? Something to mull over.